That was CGTN Xu Mengqi reporting from Wuhan. For more on Wuhan's fight against the coronavirus, be sure to watch CGTN's compelling new documentary, Epicenter 24 Hours in Wuhan. That's on this Saturday at 9 p.m. Eastern here in the United States. Well, there is much to talk about. Let's get to our panel. Cheng Li is the director of the Thornton China Center and a senior fellow with the Brookings Institution right here in Washington, D.C. Dr. Kate Tulenko focuses on global health workforce services as the founder and CEO of Corvus Health. Arthur Dong is a professor at Georgetown University School of Business and advises U.S. firms operating in China. And joining us from Beijing via Skype is my colleague, CGTN news anchor Wang Guan. Thanks to all of you for being with us. Wang Guan, let me start with you. The Chinese government has been talking about the outbreak. In fact, President Xi Jinping says measures to prevent and control the outbreak of coronavirus, also known as COVID-19, are achieving what he called visible progress. What is the situation right now? Could you explain that to us?
Well, Anand, the situation is still pretty grim, but many experts and many of my colleagues and many people who are covering the event in Wuhan, Hubei, told me that they think the worst is perhaps over. And by that, we mean that if you look at the cases outside Hubei, the epicenter, it has been dropping, like our reporter has said, for 2 weeks in a row. And also there has been quicker diagnosis, screening of all those suspected patients out of 11 million residents in Wuhan. And outside the epicenter, people have been living through a very interesting and very tough time. I'll show you something. This is a permit that I will need to show to my neighborhood to be able to come in to my own home and go out on a daily basis. There's no restriction of my movement, but I just need to show this and have my temperature taken. This phenomenon is widespread across this country. So most Chinese think that they can persevere for a little bit so that the future days and weeks and months ahead will be good in that we will all be spared of this epidemic, hopefully, and this virus.
So, Wang Guan, your movements are being restricted, as are other people's, in an effort to stop the spread of the disease. But what other kinds of precautions, I mean, someone like yourself, what kind of precautions are you taking in Beijing?
Well, basically wearing a facial mask, wearing a face mask every single day, every single second. Whenever I go out and come back, when I go to CGTN, the mothership, our mothership, to work, I need to take the facial mask. And if you look around, everyone is wearing it. And also, we avoid going to public gatherings. You know, the cafeterias, the canteens, are formatted in such a way that people eat, you know, they have a distance. And also, of course, when I read the news, I take off my face mask. People wash their hands. People try to avoid public places. If you look around the restaurants and shops and stores, many of them are still closed. But as of 2 days ago, lots of places have reopened. Actually, yesterday I did a story on National Grid. I called National Grid. And actually 60% of the manufacturing assembly lines in Guangdong, one of China's main economic powerhouses, has reopened across the country. It is a new phenomenon whereby factories and stores have reopened slowly but surely.
All right, Wang Guan, thanks for the update. We'll get back to you in a moment. Kate, as our reporter told us at the end of her report, there is a treatment that's being tested right now. It's a plasma therapy. It involves plasma recovered from patients that has started to show some effects. This is what Gao Yanhong of the Chinese Health Commission had to say about that. Let's watch this.
So far, there are more than 10,000 cured patients, which has created a favorable condition for us to use convalescent plasma in the treatment of severe and critical patients. I would like to call upon the cured patients to donate their plasma so as to bring hope to the severe and critical patients.
So how does this work, the plasma?
Okay, so when you fight infection successfully, you create antibodies. And they have these plasmapheresis machines which actually cycle all your blood and take the antibodies off. So it's a much more complex process than giving blood. It takes hours. And also there is the risk of you getting an infection from the machine if it's not cleaned properly. So you could get HIV or hepatitis C from the machine. And that's why I think they don't see as many people giving plasma as they would like. But when they have the plasma, they can then inject it into to the people who were ill, and the antibodies that are donated, they attack the virus and they allow the immune system to take care of the virus.
So you don't need a machine for every single patient. You can extract the plasma and then distribute it to many patients.
Well, you need a machine for each convalescent person who donates.
Yes, right.
But then it's given via IV to the sick person.
Okay. As we just reported, more than 72,000 people, Kate, have been infected in China. There's been almost 2,000 deaths. What is your assessment of the overall efforts being made right now?
Well, the efforts to contain it are unprecedented. I mean, we've never seen anything like this. Over 150 million people with their activities, their movements restricted, and the building of 2 hospitals in about a week. And it is encouraging that we're seeing fewer patients being diagnosed, especially since they recently loosened the definition of the case. It used to be you had to test laboratory positive for the disease. Now it's just a clinical diagnosis. That's why we saw the huge jump last week. And so the fact that it's leveling off is very reassuring. But what might be happening is people might be avoiding the hospitals. That is a risk. But I think probably it is that the true cases are leveling off.
Of course, Cheng Li, there's so many dimensions to this outbreak in China. There has been some criticism from the United States of the way in which China has handled the coronavirus, but there's been some pushback in that as well. Here is the Executive Director of the World Health Organization, Michael Ryan, talking about that. Let's take a look at this.
Some of the rhetoric, for me, has not been helpful. Not been helpful at all. China has a strong public health and health system, demonstrated. China has a strong scientific and discovery system. China has the capacity to develop and scale up vaccine production. So we need to work with China. And using words like probe, investigation, discovering cases of healthcare workers, a lot of the language is pejorative and unhelpful. So I think we, as a global community, need to change our narrative if we're going to work successfully with China and other countries to stop this disease.
We've also heard xenophobic comments being made, Cheng Li. How would you characterize China's response?
Well, of course, those xenophobic and racist remark certainly is not acceptable. And, but we do need to make a distinction. There's some legitimate criticism, especially the early days of the local government handling the case, whether be slow response or misinformation. These are certainly terrible lessons. But I think any fair-minded people will acknowledge that the tremendous sacrifice and the responsibility on the part of China. We just ask ourselves, what if China hadn't gone into lockdown in Wuhan? What kind of situation we will face? I mean, and also we see the tremendous capacity into mass mobilization, as Kate said, 2 hospitals built in 10 days, and also makeshift hospitals, 11 of them built in 2 days. And also you see the tremendous sacrifice on the medical professionals. This is thousands of people really reflect heroism. Unfortunately, that kind of story is missed in the Western media. I think certainly WHO put the right thing, that we need to work with China rather than point finger to China. Of course, there's some lessons should be learned, but actually the things that what China take show a sense of responsibility, resolution, and also resilience. I think also Chinese leadership also put the public health as a top priority, not economic development, not other matters. I think this is also right things. We should also recognize that kind of priority is certainly on the moving in the right direction.
Right, Arthur Dong, talking about the economic impact of coronavirus. And we're talking here about the world's 2nd largest economy, a massive link in the global supply chain, a big, huge manufacturing and assembly center. We just heard from Apple, the big computer corporation here in the United States. It's not going to meet its earnings target for this quarter. In fact, it's moved some of its operations from China, the China mainland, to Taiwan. So how big an impact is this going to have? And is it going to last a long time?
Yes, this coronavirus impact economically is going to be quite significant. Certainly China is bearing the brunt of this impact right now. as we have observed that Chinese consumers, when you ring-fence 70 million people, and even in cities like Beijing, which are quite remote from Wuhan, restricting the movement of citizens, the impact in terms of consumer behavior is quite significant. It's having people stay more at home. So the stores, the malls, the restaurants are all empty. That's going to have a significant impact on overall GDP. GDP now upwards of 50% of China's economy in terms of consumer and consumption behavior. And so companies like Apple, as well as a host of other American and foreign companies, are all going to start giving forward guidance in terms of already writing off Q1. The question is, will Q2 now be affected? And as this begins to persist, this is going to have a more serious impact in terms of not only China's economy, but externally as well. There are several factors that are bearing here. From an economic standpoint, there are supply issues and demand side issues. So both on the supply side, that's being affected in terms of, how companies and the entire parts manufacturing industry of China, the supply of those parts and raw materials are being affected. The demand side, in terms of the dampening of consumption on the part of the Chinese consumer, and now globally. In addition to that, you might have thought that this was just going to impact the manufacturing sector. That's not the case. This is impacting both manufacturing and services. And when you think about the Chinese tourist, single largest sector of the global tourism marketplace, well, they've virtually disappeared. And so when you look at the airline industry, hotels, food and beverage, high-end shopping such as luxury goods, all of that has been seriously impacted as a result of this.
But is there some maybe flickering light at the end of this tunnel? Because as our reporter in Beijing, Wang Guan, just told us, in Guangdong, the manufacturing capacity is back to about 60%.
Yes, so it's starting to return and return slowly. That's a reassuring sign. But the whole question is whether this will continue to persist into Q2. So Q1, we can forget about. Now the question is Q2. And just to give you an example, with regard to service revenues and service side business, well, if a movie theater, doesn't sell a seat, and now a movie theater is now empty on a particular day, now adding it to weeks, well, those revenues are gone forever.
In fact, Hollywood has been complaining because this is one of the most lucrative seasons in China.
Absolutely.
The Lunar New Year holiday.
Absolutely, and those revenues are poof, they're gone.
Okay.
And so it's going to be tough to recover from that if this continues to persist.
Wang Guan, you were telling us about the manner in which your movements are restricted in a huge city like Beijing. That logistically, that must be quite a challenge for authorities to be able to check on where people are moving and where they're going to and where they're not allowed to go to. But what about the bigger picture? Because we had so many flights, thousands of flights cancelled. What kind of communications are there that's still working in Beijing?
Well, let me make some clarifications, Anand. I said our movements are not, they're not confined at all.
Yeah.
It's just limited in that you need to show this permit.
Right.
When you go out and come into a neighborhood and have your temperatures taken when you go inside most of the buildings. I think it's fair to say that things are returning. That there's a sense of normalcy returning slowly but surely. For example, the Joy City, one of the biggest shopping malls near me, reopened yesterday. And also, Arthur has been rightly talking about the hospitality industry, tourism industry. I can tell you, Haidilao Hot Pot, one of the most famous hot pot chains in China, many chain stores of them reopened as of yesterday. So things are, it's a fast-moving situation, it's a fluid situation. And I caught myself in some traffic jams, actually, yesterday. It used to take me 30 minutes to go from my home to work. Of course, thanks to this epidemic, unfortunately to this epidemic, the travel time has been cut to 15 minutes because there was no traffic. And yesterday, traffic jam is back. So yes, flights are canceled. You're looking at a U.S. travel ban against those who have been to China for the past 14 days. Many of us think this is an overreaction, and we hope that as things progress, as things get better, travel restrictions like this can be lifted.
Right, Arthur, in fact, I was looking at a figure that we had. Your global tourism will take an $80 billion hit this year.
Absolutely. The Chinese outbound tourist is such a huge part of the overall global tourism revenue base. In terms of luxury goods, 80% of the growth in luxury goods spending derive from Chinese citizens. 40% of the entire luxury good market comes from one country, China. And so when you think about the impact on the luxury goods industry, the impact on the hotel industry, and more importantly, all these hotels and Ubers and restaurants, they all charge sales taxes. So local government revenue bases are going to be seriously affected as these hotel visits dry up, meaning those sources of tax revenues also will have a global impact.
Well, China's GDP accounts for the 20% of global GDP. Right. You can see if China lost 2% of GDP, that means probably 0.4% of global GDP, so also will decrease. So it's not just about China, but also global economy, namely all the sectors will be affected. But this is also opportunity for the future, because also we need to see how quickly China can rebound. This is related with confidence and also related to government policies. I think that the government certainly now need to help the small business in China, private sector particularly, because these are the companies most desperate at the moment. But also should uplift the confidence of the foreign business. This is very, very important for China. So I think that certainly at the moment, I think a priority is still to stop the spread of virus. But sooner or later, that will move to the second stage. I hope that period will arrive earlier, and also Chinese government will learn lessons really to improve the governance and improve public confidence and also international confidence.
Go ahead, Kate.
I think that's a very important point, and every crisis represents an opportunity. One thing that we saw in the Ebola epidemic is it really pushed mobile payments out in West Africa. There really weren't mobile payments there before that. And I think we're pushing out now new forms of mobile health. You can report where you've been and find out what your risk of coronavirus is. In some cities, you can scan a QR code when you enter or leave a building. There are online help services now, and so it's really pushing mobile health out. And I think that'll be very helpful in the future, as well as China's building this universal platform for healthcare data. The idea that every Chinese patient will have their data on the platform, and I think that as a result of this outbreak, that program will be pushed out faster.
And Kate, we are getting more details, of course, on the outbreak itself. The Chinese Center for Disease Control and Prevention says men have a much higher risk of dying from this virus than women. Why would that be the case?
They're still trying to figure that out. I mean, they're certainly finding out much more about how to treat people, not only with the plasma, but also with antivirals, but also, how soon should you intubate someone? How much should you keep them hydrated? What sort of salts and sugars do they need? So, yeah, they're really not quite sure yet why that is.
There is another figure that we have, and I'm wondering whether we should take some kind of assurance from this. And we're told that just 4.7% of confirmed cases have reached what are classified as the critical status. These are people with serious medical problems having contracted the virus. What does that tell us, the small number?
Well, that is reassuring. So in Wuhan, there's about a 4% mortality rate. Outside, there's about a 2% mortality rate. One of the challenges with these new outbreaks is there's no immunity. For example, almost everyone has had influenza. So if there's a huge influenza outbreak, at least your immune system has seen it before and can respond more rapidly. But with new outbreaks like coronavirus, most people have never encountered it before.
Okay. Wang Guan, the National Health Commission in China reports that there are 32,000 medical staff and 1,200 military medical staff in Wuhan right now. That's the center of the outbreak. What can you tell us about what they're doing and the impact that's a lot of people over there, and it's a big population, 11 million people in quarantine there. But what effect and impact is that having?
I think they're mostly doing two things. First of all, taking care of those very sick patients, the 4%, or which in earlier cases the percent used to be higher. Those very sick people need to be attended to so that more lives can be saved. And secondly, and just as importantly, tending to those who are less symptomatic or no less contagious. Because in the past, there was a lack of medical resources. There was a lack of testing kits to test enough people. However, these people were out and about passing the virus to others. So it's very important to screen and diagnose as many people and as accurately as possible so that we can cut the path of transmission. That's why 11 makeshift hospitals have been converted from gyms and convention centers in the epicenter so that more people can be screened and diagnosed, can be taken into the hospital so that they will not be out and about passing the virus to others. Those are the things that the medical staff have been doing. There are a lot of heroic stories. We've seen the reports coming out of Wuhan and Hubei. People it's a battle against time. It's a battle against limited, resources in the beginning. And I think they are really, the medical staff are the unsung heroes that deserve the most praise and credit.
Arthur Dong, of course, this is the biggest challenge for China right now, but there are other challenges as well. There have been heightened trade tensions between China and the United States for quite some time. There was some relief in those tensions with the signing of phase 1 of the trade deal. But as it stands right now, can China fulfill the deal as it's supposed to with the virus outbreak? I mean, there is a clause in the deal that makes provision for what's known as natural disasters, and I'm guessing this would qualify as one of those.
Oh, yes, certainly. I think this complicates the picture with regard to China's obligations under the most recently concluded trade agreement. What I've heard from the logistics industry alone, that the container ships that are at port in Shanghai, they're only running 10% full. So you might have a container ship that can hold 20,000 containers. They're leaving port with only 2,000 containers. So these supply disruptions are quite severe. And when you have these supply disruptions, even imported products that are coming into China, they're sitting at port because you don't have enough customs officials who are on the job, as well as dock workers, to unload those ships. So at least for this quarter, we're having some serious supply disruptions, which are also going to impact China's ability to fulfill its obligations under its most recently concluded agreement.
Kate, we don't have too much time left, but I do want to get to this, and it's an interesting question. Dr. Anthony Fauci at the National Institutes of Health here in Washington, he's talking about the quarantine of more than 3,000 people on that cruise liner, which is in Yokohama in Japan. He said, despite all the efforts, the quarantine that is, to stop the virus from spreading, we've had 542 cases so far of people actually getting the virus. How did the quarantine fail in that way?
Well, I think most of those people actually probably contracted the disease before the quarantine went into place. When you look at a cruise ship...
And didn't show symptoms?
Yes. Yeah, it can take up to a week or longer to show symptoms. There's often a single dining room, people pass through like a single set of halls. And so planes and cruise ships are sort of the perfect environment for outbreaks. In fact, the CDC is kept very busy with cruise ship outbreaks in general.
Cheng Li, one other question, and that is, the way China sees this and the way the world sees it. Bloomberg, the US news outlet, very influential economic and business news outlet, put it this way. It says, China is sacrificing an entire province to save the rest of the world. Is there the recognition in the United States of what that means?
Not yet, but I think sooner or later, and more and more people will recognize that. And again, the difference between flus and also another pandemics and also the current virus is that the Chinese government want to contain, tries very hard. That's, again, it's really quite remarkable. I think this is what Bloomberg said, China sacrificed one province and to do that. This is also tell sometimes, liberty and the security and public health and individual privacy and the small community and big community. This certainly led us to think about these tough questions in a very connected world, but people still think about themselves. I think this case, certainly more than anything else, tell us that we live in a globalized world and we need to cooperate on this kind of common cause. And hopefully we will find some common purpose.
Kate, is it sometimes is the problem the way this is being framed? I mean, we look at the United States, there were what, I'm looking at the figures here, 26 million Americans have been infected with the flu virus, 14,000 deaths.
Yep. Yeah. And just to give an example, the majority of children who die from the flu in the U.S. were not vaccinated. So people don't even take the measures that they could to save their children. So yes, many people do die from the flu. I mean, part of this is the fear of the unknown. You know, we're not sure how this disease is going to change. With the Spanish flu, it actually was in 2 cycles. Well, first one cycle where people were just sick for 3 to 4 days, and then it appeared to mutate and become much more deadly. And people just don't know what's going to happen.
We're going to have to leave it there. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching. Hello, everybody. I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week, we take a deep dive on world headlines, talking to experts, journalists, and others. It's a fresh, focused, and intimate look at the issues that matter most. Whether it's the Hong Kong riots, the latest Middle East conflict, or US politics, the Heat podcast gives the clear context needed to understand both what's going on and why. And what's best, we come to you. Whether you're at home or on the go, you can find the Heat podcast just about anywhere podcasts are found. Just search The Heat CGTN. Have a listen today and subscribe.